In severe cases of a respiratory infection, like flu or COVID-19, the brain doesn't get enough oxygen from infected lungs. Starvation of oxygen can cause temporary or permanent damage to brain cells. Some of the symptoms of this could be vision problems, pain, dizziness, fatigue, and brain fog, anxiety, depression, insomnia. The COVID-19 virus also attacks brain cells and nerves directly. Some studies of long haulers have found that there's a reduction of activity in some areas of the brain. Hormones such as serotonin, the happy hormone, and dopamine, the motivation hormone, can be decreased in an oxygen-starved or inflamed brain. So loss of joy and motivation can also develop. Neuroscientists at University College London have shown that COVID-19 also causes blood vessels that supply the brain to narrow, causing reduced blood flow and a tendency to clot. This causes problems with mental ability, including memory and alertness, as well as blood pressure, heart rate, and breathing. And it can even cause coma. An infection with C19 can even cause stroke. In a UK study published in August 2021, the brains of 401 people who had had previous brain scans before a COVID-19 infection were found to have been infected by the virus. This was seen to have occurred via the nose, and multiple changes to brain tissue were observed, including multiple mini-strokes within the brain. Certain brain cells may also have become hyperactive and undergo a process known as excessive pruning, where they start clearing up cells that are still healthy in the brain, as if they were waste. This could explain some of the memory loss and poorly functioning memory in long COVID. Memory cells can be completely obliterated. It's not uncommon for people who suffer respiratory distress to have no recollection of their time in ICU. There was a case of a man who, after having had a bad case of COVID, couldn't recall a trip to Paris he had been on 3 weeks before his infection.